So, why did we decide to start a mental health inpatient program? Well, it's thankfully a lot of the stigma in the country about mental health is starting to be exposed and to be changed. People are talking about mental health. It's a big deal, right? They're talking about it in schools, athletes are talking about it, and in all walks of life, everybody's realized that we have a mental health issue in our country. And unfortunately, there's not a lot of resources to help deal with that, right? There's medications, which can be very helpful. There's psychiatrists that can be very helpful. Problem is, getting in to see a psychiatrist can take you 6 months sometimes, right? There are not a lot of primary mental health programs out there for people. And so, taking what we've learned from our substance addiction and substance use disorder treatment programs and applying some of the same foundation, let's get people out of the system that's causing them stressors, right? Get them in an emotionally sanitary environment where they can learn the coping skills, they can learn what they need to address PTSD, bipolar disorder, anxiety, depression, schizoaffective disorder, OCD, just to name a few. Get them in that emotionally sanitary environment, get them those coping skills, get them those resources, help them build a sense of community, right? Before they need to go back to their environments. Again, with the same idea, what we want is for people to be productive members of society, for people to be happy, for people to feel fulfilled, for people to feel like their life has purpose. And so getting somebody anchored to a program that can really take the time to focus on their mental health has made a huge difference in the Kansas City community.